Hello, friends and families. Welcome to the Educa DPS podcast. My name is Javier Ibarra, your host of the English version of our Educa platform. I am the Senior Manager of Media and Public Relations for Denver Public Schools. Our guest today is Aurora Soto, School-Based Health Clinic Manager for Denver Health. Hi, Aurora.
Hi, how are you?
Good. How was your drive-in today?
It was wonderful. I actually carpooled, so
Oh, fantastic.
it was great this morning.
I want to ask, in order for our audience to get to know our subject matter expert, can you briefly share who Aurora Soto is and what is it that you enjoy the most?
I mean, on a personal level, I think I'm an adventurous person who loves to spend time with my family and friends. I love hiking, doing outdoor activities, and a good rock and roll show doesn't hurt anyone.
Wow, I wouldn't have taken you for rock and roll.
Rock and roll.
Yes. Today, I want to share with our community a little bit about the topic. DPS is proud to partner with Denver Health to operate multiple school-based health centers throughout the city. Services are provided by medical professionals, including physicians, physician assistants, nurse practitioners, and mental health therapists. There is no charge for a student to use health centers, and services are provided in confidentiality. My first question, Aurora, is this. What is a school-based health center or school-based health clinic?
Sure. A school-based health center is really a full-functioning pediatric clinic that are inside Denver Public School buildings to provide care to the students of Denver Public Schools.
How many do we have at DPS?
I'm so proud to say that we just opened our 19th school-based health center in 2022. January of this year, we celebrated a first-year anniversary. So it's 19 school-based health centers.
That is amazing.
Yes.
Who are the school-based health center services for?
So school-based health centers can provide medical, dental, vision care to students that are enrolled in any Denver public school and their siblings.
And what kind of services are provided there?
We provide a variety of services. For example, medical services may include well-child checks that can be utilized for either sports or camping.
Like a physical?
Like a physical, exactly. Okay. Physical examinations. Within that physical examination may lead to some laboratory examinations to check for either diabetes or cholesterol, high cholesterol. We also offer immunizations, including the COVID-19 vaccine. We offer chronic care for either asthmatics or lesions, injuries, things like that. We also variety of services that include behavioral health. So we help students when they have either anxiety, depression, or substance abuse. We offer either individual, group, or family therapy as well. We're happy to say that we have dental services as well in our school-based health centers that provide x-rays, cleaning, fluoride, and much, much more.
So it's not a small clinic by any means. It sounds like you can get a lot of services at these clinics.
There is. Their space may be small, however, the services is grand. We provide really confidential services as well, and so absolutely.
I have a tagline for you. The space is small, but the services are mighty.
That's it.
Take that back to
Yes, I
will. My next question here is, what are the benefits of providing health services in our DPS schools?
I think there are many benefits. I think one that stands out is, as a parent, it's really difficult for you to get a phone call from the school nurse and say, your child is here, that you need to come get him. And then I have to figure out how to get out of work, go pick up my child and try to schedule an appointment with their medical provider. And most times it is 2-3 weeks out. And so the benefit I feel is it limits the time that the student is out of class. So we're able to diagnose and treat within 30 minutes. And send the student back to class. So it limits the time out of class for the student, and it limits the time out of work for the parent.
I'm glad you mentioned that about the attendance piece because right now we are launching an attendance campaign for our students, and this is a great way, right? It's we say whole child
Sure.
at DPS, but it's providing services much more than just the academics. It's around all of the needs of the child because that affects your learning environment.
Absolutely, absolutely. I agree.
What are the days and hours for a clinic like these? I don't imagine they're, at night or what are they, what are the
Sure.
hours?
So our business hours are Monday through Friday from 8 a.m. to 4:30 p.m.
Wow, okay. So I can go in there during the school and I don't have to go on weekends.
Absolutely, you can go in during the school hours. Again, if a student needs to come and to obtain services from our health center, whether it's a near infection or they need like a concussion, we also are able to help a kiddo out with a concussion. We do hearing and vision if a kiddo's having headaches. Let's check the vision, and 9 out of 10 times it's a simple thing of they need glasses, and so we're able to do that during the school so that they don't miss so much school.
I make the joke, and I'm glad you said this. I make the joke that if I were have been diagnosed that I needed glasses early on,
Yeah.
I would have graduated with honors.
That makes two of us.
Yes. So how can students make an appointment?
Sure, we have simple ways of scheduling appointment. One, you can contact the school-based appointment line or visit our website.
And for the folks watching here, we're gonna place that right here. Um, earlier on in the show, I mentioned that there wasn't a cost. Was I lying?
Absolutely not. You're 100% true. There is absolutely no cost to the families for obtaining services in a school-based health center. We do not collect copayments, deductibles, any type of fees in order for your child to be seen in our school-based health center.
Is there a tip jar?
No. Tip jar, stay in school.
Yes, that's awesome. How do you deal with confidentiality? What can teens do if they need to talk confidentially?
I think that confidential services are extremely important. Confidentiality of a patient is our number one priority. What I want students to know is that they can comfortably walk into a school-based health center, speak to a professional provider that can discuss confidential circumstances, and know that it's going to stay with that professional provider and that patient. Unless the patient gives us permission to disclose any medication, any type of information, then other than that, it'll stay confidential, or if it's a life-threatening situation.
That's good to know. You mentioned this earlier in the show, but why is it important to keep up with immunizations?
Sure. I mean, we all do our very best to keep our families safe, right? Immunizations are safe and they work, right? They help protect you from, they help protect before your child is exposed to any serious diseases.
Thank you for that. And thank you, Aurora, for this valuable information. I think that these school-based health centers or clinics are such a blessing, I would say,
Sure.
to our students, to our parents and families who might need some more services, but this helps out in a way that they don't have to take the time off to take the student, right? Because they're
Correct.
minors, and they don't have to travel far, and there's no copay. You don't even have to tip them.
100% correct. No tipping involved. All our services are at no cost to the families.
Well, thank you so much for joining me
Of
today.
course. Thank you.
Well, friends and families, this concludes our Educa DPS podcast for today. I want to ask if you can help us share this content with families, friends, and other community members who might want to know more about the services mentioned here today. For more Educa content and other stories, please visit our YouTube channel at Denver Public Schools Plus. It is important for us to give credit to the people behind the scenes who contribute to making this and all of the DPS multimedia productions. I want to start off with our Executive Director of Communications, Will Jones. Thank you to our Director of External Communications, Scott Pribble. To our Director of internal communications, Selena Nakamura, our executive producer and videographer, Don Pierce, our multimedia lead producer and host of the Spanish Educa, Beto Gaitan, our guru of social media, Hannah Young, communication specialist, Georgia Alexander, strategic communication specialist, Trey Hill, our public relations manager, Ray Childress. A special shout out to our DPS educators, students, and parents. And a big thank you to our leader, Dr. Alex Marrero, proud superintendent of Denver Public Schools, for supporting Educa and all of our other platforms. Yours truly, Javier Ibarra, Senior Manager of Media and Public Relations, as well as the Educa host in English. Please remember to tell your children more often, I believe in you, and I know you can do it. Until next time.